Childhood should be a time of joy and exploration, but for some, it's overshadowed by mental health disorders. Mental health disorders are real, treatable conditions that impact thoughts, feelings, and behaviors. Behavioral changes in academics, social interactions, and emotions may indicate concerns. These struggles affect learning, relationships, and potential. Subtle signs warrant professional evaluation. Recognizing early signs of mental health disorders is crucial. Early identification and support can help children thrive. Intellectual disability involves various developmental disabilities affecting intellectual functioning and adaptive behavior. These limitations are not just slower learning, but fundamental cognitive differences. Programs provide specialized therapies and support tailored to individual needs. The focus is on fostering independence and creating a supportive environment. Autism Spectrum Disorder, ASD, affects perception and interaction. It includes challenges in social communication and repetitive behaviors. Sensory processing differences in ASD impact daily life. Sensory overload can lead to meltdowns or shutdowns. Creating sensory-friendly environments is crucial. Supporting individuals with ASD requires a multifaceted approach. Fostering acceptance and understanding promotes inclusion. Early intervention and specialized therapies improve skills. ADHD is a neurodevelopmental disorder affecting attention, impulsivity, and hyperactivity. It's a real neurological condition. Children with ADHD struggle with focus, impulsivity, and hyperactivity. This struggle impacts academics and self-esteem. ADHD is not a sign of laziness or bad parenting. Children with ADHD are not choosing to be inattentive. Conduct disorder involves persistent behavior violating others' rights and societal norms. Conduct disorder manifests in various problematic behaviors. Behaviors range from aggression to deceitfulness. Children may lack empathy and struggle with relationships. Understanding underlying factors is crucial for effective intervention. Without intervention, these patterns can persist into adulthood. Parent training and therapy address behavior and family dynamics. Oppositional Defiant Disorder, ODD, involves persistent defiant behavior. ODD is a complex disorder with biological and environmental influences. While the exact causes are not fully understood, research suggests that a combination of genetic predisposition, neurological differences, and environmental influences play a role. Understanding the underlying factors that contribute to ODD is essential for developing effective interventions. Children with a family history of ODD or other mental health disorders, such as ADHD or mood disorders, may be at increased risk. Neurological studies have shown differences in brain structure and function in children with ODD, particularly in areas of the brain involved in emotional regulation and impulse control. Environmental factors, such as inconsistent parenting styles, family conflict, or exposure to trauma or abuse, can also increase the likelihood of developing ODD. Children who grow up in chaotic or unpredictable environments may learn to use defiance as a way to gain control or attention. Children who are struggling with these conditions may exhibit defiance as a way of coping with their emotional distress. They engage in power struggles and hold grudges. It's important to note that ODD is often a symptom of other underlying mental health conditions, such as anxiety or depression. Supporting children with OD requires a multifaceted approach that addresses their emotional, behavioral, and social needs. Parent training programs, such as parent management training or PMT, teaches parents how to establish clear expectations, provide positive reinforcement for appropriate behavior, and implement consistent consequences for defiant behavior. Cognitive behavioral therapy, or CBT, can help children with OD identify and modify negative thought patterns, develop coping mechanisms for anger and frustration, and learn problem-solving skills. Social skills training can help children improve their communication and interpersonal skills, reducing conflict and improving their ability to form healthy relationships. Medication is not typically used as a primary treatment for ODD. However, in some cases, medication may be prescribed to address co-occurring mental health conditions, such as ADHD or anxiety, that may be exacerbating OD symptoms. Tourette disorder is a neurodevelopmental disorder characterized by tics, sudden, repetitive, involuntary movements or vocalizations. These tics can range from simple movements such as eye blinking or throat clearing to more complex sequences like jumping, twirling, or repeating phrases. While shouting obscenities is often highlighted, it's relatively rare. Most individuals have milder symptoms. It's important to remember that tics are involuntary and that children with Tourette disorder are not choosing to tic. Punishing or criticizing a child for their tics is not only ineffective, but can also increase anxiety and stress, potentially exacerbating tic severity. Creating a tic-friendly environment involves minimizing stress and anxiety, as these can often worsen tics. Providing children with Tourette disorder with coping mechanisms for stress, such as relaxation techniques, mindfulness exercises, or physical activity, can help them manage their tics more effectively. Cognitive behavioral therapy can be helpful in addressing any co-occurring mental health conditions, such as anxiety or obsessive-compulsive disorder, that may be present. Separation anxiety, those tearful goodbyes at daycare or preschool, are a normal part of childhood development. However, when this anxiety becomes excessive, it may signal separation anxiety disorder. This intense fear can significantly disrupt a child's life. This fear is often accompanied by physical symptoms, such as headaches or stomach aches. They might cling to their parents, plead with them not to leave. Addressing separation anxiety disorder requires a compassionate and supportive approach that helps children gradually build their confidence and independence. Creating a predictable and reassuring separation routine can be incredibly helpful. This might involve establishing a consistent goodbye ritual, such as a special hug or phrase, and gradually increasing the duration of separations over time. Positive reinforcement plays a crucial role in building a child's sense of security. Praising their bravery, acknowledging their feelings, and rewarding their efforts to manage their anxiety can go a long way in building their resilience. In some cases, involving the child's school or daycare can be beneficial. Teachers and caregivers can create a welcoming and supportive environment, providing extra reassurance and support during separation times. If separation anxiety disorder persists or is particularly severe, seeking professional help from a mental health professional specializing in childhood anxiety disorders is recommended. Cognitive behavioral therapy can equip children with coping mechanisms to manage anxiety, challenge negative thoughts, and gradually face their fears in a safe and controlled environment.